Medical experts are reassuring the public that AstraZeneca is safe after BC recorded its second case of blood clots linked to the vaccine. The man recovering from the rare disorder made his story public on social media. Here's CTV's Alyssa Tebow with what you need to know.
From a hospital bed, Sean Muldoon revealed his story. "I had a massive blood clot," he wrote on Facebook, 17 days after receiving the AstraZeneca vaccine. His first emergency surgery, he says doctors removed over 6 feet of his small intestine. A friend of Muldoon told CTV News his family was not ready to speak with the media. This is BC's second case revealed by Dr. Bonnie Henry Thursday.
This person is a male in their 40s who is in stable condition now.
The rare disorder is called vaccine-induced thrombotic thrombocytopenia, known as VIT.
It causes blood clots wherever there are blood vessels. So basically that's all over your body.
On Thursday, Canadian officials said there were 28 cases across the country, with more than 2.3 million doses of AstraZeneca distributed. Officials have previously said the risk of developing the disorder was around 1 in 100,000 doses.
The risk of blood clots is a little bit higher than we had initially thought, probably closer to the 1 in 55,000.
So we put some questions to experts. Is it safe?
Absolutely. In fact, full transparency, I register at 5 different pharmacies to try to get the AstraZeneca shot.
What about getting AstraZeneca for a second shot?
If you did well with the first shot, the risk of a blood clot or any serious side effect of a second shot is exceedingly low, 1 in 1 million, perhaps even less.
What if you've had the vaccine and developed symptoms?
Call 811, call your doctor, go to the emergency room.
A message echoed by Muldoon. Health officials say AstraZeneca has been an important part of BC's vaccine rollout, and Dr. Wallach has a message for those who did get it.
Thank you. By getting the AstraZeneca vaccine, you helped break the chains of transmissions.
Alyssa Tebow, CTV News, Vancouver.